Arteriolosclerosis is the thickening or hardening of the walls that line the arteries. When your arteries are blocked, it can cause damage to the arteries. These are blood vessels that are used to carry blood from your heart to the remains of the body. The arteries are lined with a thin layer of cells that are called endothelium. The cells on the inside of the arteries are what keeps the blood flowing. Arteriolosclerosis is when there is damage to the endothelium, which causes problems. Arteriolosclerosis is usually the main cause of heart attacks when there isn't enough blood flow to the heart due to a blockage. It is also the main cause of strokes and vascular diseases. The damage to the endothelium causes plaque to build up along the walls of the arteries, which blocks blood flow to the rest of the body. Plaque creates a bump in the artery wall. What are the causes of arteriolosclerosis? Damage to the endothelium, high blood pressure, smoking, and high cholesterol. Symptoms of arteriolosclerosis include aneurysms, angina, chronic kidney disease, coronary or choroid heart disease, heart attack, heart failure, peripheral artery disease, stroke, or unusual heart rhythms. Signs and symptoms can vary based on what artery is blocked. Coronary artery are as follows: arrhythmia, an unusual heartbeat, pressure in the upper body, known as angina, and shortness of breath. Related to the arteries not delivering enough oxygen to the brain are numbness or weakness in arms or legs, a hard time speaking or understanding, a droopy face, paralysis, severe headache, or trouble seeing in one or both eyes. Symptoms that are related to the arteries of your arms, legs, and pelvis include leg pain when walking and numbness. Symptoms that are related to the arteries that deliver blood to your kidneys are high blood pressure and kidney failure. Diagnosis. Your doctor will start with a physical exam to listen to the arteries and check for weakness that may explain the issue. Following tests may include an angiogram and includes dye being put in your arteries so that they're easily visible on the x-ray. Ankle brachial index, which is a test to compare blood pressure in your lower leg and arm. Blood tests to look for things that raise your risk of having arteriolosclerosis, which is high cholesterol or blood sugar. A chest x-ray to check for signs of heart failure. An EKG, which is a record of your heart's electrical activity. A stress test. When you exercise around healthcare professionals, they watch your heart rate, blood pressure, and breathing and monitor it. Usually once a blockage is there, they are hard to get rid of. Some medications are prescribed, lifestyle changes, and treatments that are suggested to stop or slow the plaque buildup. Lifestyle changes include a healthy diet, exercise, and no smoking. Medication, drugs that are given for high cholesterol and blood pressure, may slow or stop arteriolosclerosis. These medications can lower the risk of heart attacks and strokes. Angiography and stenting. A thin tube is placed in the artery where the blockage occurs to reach the diseased artery. They use a catheter, which usually opens up the blockage, the stent. Stenting can also help prevent symptoms, but there's still a risk in heart attacks. Bypass surgery. The surgeon will take a healthy blood vessel, usually from your chest or leg, and use it to wrap around the blocked artery to allow blood flow again. Endarterectomy. The doctor goes into the arteries in your neck to remove the plaque to restore blood flow. Fibrinolytic therapy, a drug that is used to dissolve the blood clot that is blocking the artery. Thanks for listening. If you have any questions, feel free to ask.